Fresh health warnings are being issued tonight for anyone who isn't vaccinated against the measles, including pregnant women. Michelle Mackey with what Ontario's top doctor is saying after a baby who was infected with the illness passed away.
It's a measles, mumps, rubella vaccine, can prevent this from occurring. It's almost 100% protective, and it's certainly, if you're thinking of getting pregnant, it is something you would want to have checked with your family care provider to ensure that you're protected.
Dr. Kieran Moore says the mother was unvaccinated, and the infant also faced other serious medical complications unrelated to the virus. That's why Dr. Marjorie Dixon with Inova Fertility says she tests people for measles immunity during the pregnancy planning stage.
If they are not immunized, we get them to be vaccinated before they start trying to get pregnant. And sometimes that puts people off because they have waited a long time to see a fertility specialist, but it only is for 1 month.
After a month, immunity kicks in. But for pregnant women who are not immunized, they can get infected with measles and put the baby at risk.
For the baby or the exposures in pregnancy, it can be preterm delivery, preterm labor, prematurity, small for gestational age babies, and then ultimately potentially stillbirth.
Dr. Dixon says typically people get their first MMR vaccine at 12 months and a second dose between the ages of 4 to 6 years old. However, babies 6 to 11 months old can receive the vaccine early if they've been or may be exposed to measles. Some adults may also need a booster if their immunity has waned.
And the vast majority of women across Ontario are protected, but sadly there are pockets of individuals in the Southwest in particular that have not adhered to vaccination as a core health strategy.
He says this includes several religious communities.
We are working with their leadership, with their communities. Some of the communities prefer to speak in Low German, so we're translating our documents to Low German and using radio and press and community leaders to reach out and to provide education to them.
Listen to what public health tells you to do. If you're not vaccinated, get vaccinated, because there's something called herd immunity. And if you are non-immune, the risk is that you will put the people who are at greatest risk, the immune compromised, infants, and the elderly.
This marks the first death in Ontario's current measles outbreak. A child under 5 died of measles in the spring of last year. And prior to that, a death from measles had not been reported in the province in more than a decade. In Toronto, Michelle Mackey, City News.